Good day, ladies and gentlemen. Welcome to the Introducing Kroll webinar. I would like to introduce Russell Ingleton and Scott Belfer. Please go ahead.
Thank you very much, Fanny. So on the line, I'll let him introduce himself. He'll be actually just handling the A part of the Q&A. So Scott, if you could introduce yourself.
Hi, everyone. My name is Scott Belfer. I am a licensed pharmacist working with the TELUS team. I've been with the company now for 5.5 years, and I still do practice part-time to keep my license up. I think that's about it. So I'll turn it back to Russell.
Sure. Not a problem. Thanks, Scott. And my name is Russell Ingleton, and I've been with TELUS since TELUS acquired Kroll Computers, and with Kroll for about 30-some-odd years. And they've asked me to do a presentation of the Kroll system. And for those of you that might know me, or at least certainly my colleagues do, is that I'm a little bit passionate with this. And typically, me to do a very basic Kroll presentation takes about 3 or 4 hours. And unfortunately for me, they asked me to condense this to about a 45-minute presentation. So I am going to be just barely scratching the surface on the Kroll system. I'm afraid I may not be going to give it enough justice as to show you all of the bells and whistles, and I'm just going to be able to show you the basic filling process. So really today I'm just going to be talking a little bit about the initial screen that's on Kroll and going over the very basic patient, drug, and doctor files. We'll actually fill a prescription, and I'll show you how the workflow aspect of the Kroll system works. But then I'm going to turn around and just basically disable the workflow aspects and then do the very same prescription again to show you what a real basic fill and bill system looks like as well. I'll talk just a couple of minutes on conversion, and then as I noted at the very end, we'll open the phone lines to see if you can field any questions that you may have. So as noted, at any point, just click on that Q&A. You can ask questions. Scott will try to reply, and maybe at the end here, too, if any come up, Scott may share with the entire group if he hasn't actually already done so. So again, this is basically the Kroll start screen. As you log in, once you've logged in with your username and password, this is where everything begins from. I'm going to be covering, as I say, some of the real basic functionality. And across the top here, we have some of the standard function keys that's used throughout. After a couple of minutes, you're just going to know what those keys are because we use them throughout the entire system. In this case, we're looking at what's called the dashboard. And across the top of this dashboard, we've got certain tiles. These tiles have little numbers in them whenever there's some item in those areas that needs your attention. So, I've got in this case 2 doctor callbacks that I need to be addressed at this point in time. And on this one screen right now, the main dashboard, for example, showing me I've got 3 prescriptions that are currently overdue, it looks like in the data entry area. Just a couple of tiles to cover them off real quick. For example, here's an inbound document tile. I've got 3 items that have come inbound from likely a fax machine or possibly a document scanner that I need to address. And another example here might be my calendar tile on the far side where I've got something due today or upcoming sometime today on my calendar that I will need to be addressing shortly. So again, those are just sort of some of the common tiles across the main screen. Now, what I want to do is I'm just going to start off with the major cards, the patient, then the drug, then the doctor. Then I'm going to pull them all together and actually fill a prescription. And to speed this up, I'm already going to have those cards in my system. So I'm just going to show you an existing record that shows. So I'm going to go into my F3 patient card. Patients can be pulled up with their phone number, their personal health number, their other third-party numbers. The easiest way is just type part of the last name, a comma, part of the first name, and it will find all of the matching patients that you've entered in there. You can just mouse down or double-click or select the number beside it to select the item that you actually want. So on the patient card, we've got some very basic demographics on the left. Over and towards the middle, we've got telephone numbers. You can enter an unlimited number of telephone numbers. Optionally, you can select the patient's GP if you want to. Some basic demographics of birth date, male, gender, language and height. Third-party information, including the provincial plan if you need to. Allergies, medical conditions. I can group patients. and I've got some additional basic demographic information on the patient. And later I've got information about their family. I can put them into a nursing home. I can tell how they're going to be communicated with and so on. Typically, after the patient is the patient profile. So from the profile, I can take a look here at the top, in this case, the top 12, I can page down to get other ones. And the profile is completely configurable. This is all Windows-based, so I can drag and drop and move columns around, make them wider or narrower, and I can configure which columns, many other columns in addition to just these that are shown here. And again, that's just scratching the surface on a patient record. F5 is my drug record, just like kind of like the patient. I can type in the drug brand name, I can type in the generic name, I can use the DIN, I can use the name and a comma followed by the strength, and many other things to be able to actually access the drug card. So here's just an existing drug card where I've got, again, the basic information with the brand and generic name and description, and you can configure your system as to which of these print on your label sets and in which order they print in. Across the center here, I've got DIN and strength, the form and route of minute comes in. Over here, I've got some flags on it indicating whether it's a reportable, whether it's part of my RX Sync program. And on the lower half of the screen, the way that the Kroll system sets up their drug card is the upper part of this screen is the main drug card. The lower part typically are the multiple pack sizes. So if I do need another pack size to add, I can just simply bring up the one drug card, hit the insert, and insert a new pack size. I'm not actually duplicating the entire drug card again. A couple of things along the bottom I'd like to point out to you. Besides all the different pricing fields, I do have some basic ordering information here, but I'd like to go over to the ordering tab and just show you a little bit and talk to you briefly on the inventory system. The Kroll system certainly maintains inventory on all the products should you want it to. I can actually disable inventory if there's any items like OTC products that I don't want to maintain inventory on my dispensary system. By default, you can set the items to go up on automatic ordering. You can also, for any one item, though, if you want, you can actually also disable the automatic ordering. And the way the automatic ordering works is, just like probably most systems, you can set a minimum reorder point, and when you get below that minimum reorder point, the drug will go back on order at the typical end of the day. But one of the other things that you can do on the Kroll system is, in addition to setting an absolute minimum reorder point, you can also set a day's supply reorder point. Every single time you fill a prescription, or a day goes by that you don't fill a prescription, the system is recalculating out the average daily usage so that you can set the system to order, in this example, a minimum reorder point of 7 days, which is equivalent based on the current usage in this example of 16.8 units. Well, the advantage to using this is that as your usage on the product increases, so too does your actual minimum reorder point. Now, you can certainly maintain that manually if you want to, but the real advantage is when the usage starts slowing down, so too does the minimum reorder point. If you're setting only an absolute value, you always know when to boost it up if you end up running short because the usage is increasing, but you rarely know to actually reduce it when your actual usage is also decreasing. So by using a day supply reorder point, the minimum will automatically adjust based on your usage. But for those of you who just want to do the tried and true and set the absolute minimum point in, we also allow to show you the drug usage graph for each of the last 5 years. You can actually see the individual number of units and number of prescriptions for each month over that 5-year period. And now, basic on the doctor. A doctor record you can also pull up by part of the last name, the first name, a telephone number, a license number, and a couple other things as well. Not much to it, but the one thing on the doctor card, and I forgot to mention about the patient card as well, is the doctor card and patient card can actually have multiple addresses. So I can actually record the different clinics or the hospitals that the doctor actually prescribes at. And later when I'm dispensing a prescription, I can even indicate at which location it was that he actually prescribed that from. We've got the doctor, the licensing body, license number down on the bottom here. Again, unlimited telephone numbers, grouping capabilities, and certain flags for the doctor. I can, for example, indicate that he does not accept fax refills, or he does or does not accept phone refills. And as you see on the bottom part of the screen, by incorporating a document scanner into the Kroll system, you can actually scan one of his prescriptions in and actually crop out the part where his signature appears and attach that to this doctor record. So you can use that for reference later on when you're ever validating a prescription, should you want to. And I'll talk a little bit more about doctors or about document scanners, even signature capture pads later on. So back at the main screen, what I'd like to do now is those are the absolute basics. And again, I'm really just touching on the very basics. I'm going to actually walk through now the filling of a prescription. Now, what I've actually got set up on my system here is the first prescription I'm going to fill is I'm actually going to walk you through all of the different workflow steps that you can actually configure for your system. But this is all configurable. And while I'm actually going to set these up where I've got about 6 different queues on here, you could also configure your system for just a simple fill and bill where there's practically no workflow at all. And I'm going to deliberately walk through the filling of a prescription, showing you these different workflow queues, but I'm going to make certain when I'm done that I go back and I fill the very same prescription without any workflow enabled, because I don't want you coming away thinking that it's going to take so long just to fill a basic prescription through the Kroll system. All of this is optional and completely configurable based on how much workflow you want to implement in your dispensary. So in this case, what I'm going to do is I'm going to walk through the entire path of a prescription. I'm going to start off right at my drop-off window. I'm actually going to select, in this case, my F11 button to go into my drop-off screen. And like I did earlier, I'm going to type in part of the patient's last name, a comma, part of their first name, and bring up that patient on my screen. At this point, I have the patient in front of me. I can verify that I've got the correct patient, that there are or are not any updates to his file, his address or phone number information. I can pull that back up to my drop-off screen at that point with a summary on the top of the screen. And then what I want to do is I want to scan in their prescription image. So in this case, I'll have a document scanner right near my drop-off screen. I'll scan in his prescription image. And then what I can do on the right-hand side, optionally, I can start doing some of the initial data entry should I want to. Remember, I've actually got the image, so I can even offload this to the next step in my workflow. But in this case, I've decided I'll actually do some of the initial data entry myself. In this case, I'm going to add this particular prescription to this, what we call a work order. I'm going to bring up the patient's profile because they may have 1 or 2 refills that they also want doing at the same time. So I'll select one of those prescriptions on their file. And down here, what I'm actually doing is I am creating this work order. In this case, it contains 1 new RX and 1 refill prescription as well. At the bottom here, I can decide to either fill now or I can fill later. If, for example, I've got a lineup at my drop-off counter, I want to keep that lineup as short as absolutely possible. So what I'm going to do is I'm going to select the Fill Later button. This is going to return me back to a blank drop-off screen. I'm going to dismiss that patient, and I'm going to say Next. And that way, again, I'm going to type in the next patient's name, scan in their prescriptions and or their refills, and then be able to dismiss them so I can keep my drop-off lineup as short as absolutely possible. So I'm back to my main start screen. And here I have my 2 prescriptions in my my data entry queue to complete my data entry, and they're currently due based on the time I promised the patient somewhere within the next 60 minutes. So now, to get into the meat and potatoes of the actual workflow area, I'm going to go into my F9 workflow, and this brings up all of my different queues. Now, in a larger dispensary, you may have different terminals dedicated to different steps in the process of filling a prescription. You may have one terminal that's just dedicated, as an example, for packaging. You may have another terminal that you do all of your final verification on, and so on. So the idea is for us to try to design the different queues to match the actual queues in your own dispensary today. So for example, right now, I've actually got a couple of queues enabled here, my data entry and my adjudication queue. And ultimately, the idea is I'll start working on these prescriptions, and all I'm going to be doing them is data entry and adjudication, and then I'm going to be passing them off to someone else at the next screen, potentially doing the packaging of that product. But we also realize that if you're the only person working around, it's early in the morning or later in the day, it would be a little silly for you to have to just do the first couple of steps and then walk down to the counter to the package step and then walk down to the counter to the verification step. So at any point in time, if you want to, you can turn any one terminal into doing any one or multiple of the queues. So instead of just having the 2 queues enabled, I can turn on all of my queues right now. And I'm going to do that so that I can take this one prescription and sort of walk through each individual step right to completion. Now, the items that I created, as I created a work order when I was scanning that prescription in earlier, one thing I didn't show you is that I can actually enter in a promise time in there. So if I know the patient's not going to be coming back until tomorrow, I can actually set the due time until tomorrow morning if I want to. And basically what happens is it will reorder all these prescriptions based on that promise time, so that when I start working on the queue, those items that are due sooner are going to be at the top of my queue. Those that are not due until later in the day or even tomorrow will drop down at the bottom. Now, however, at any point in time, you know that that patient will come back in that you weren't supposed to see till tomorrow, and they're suddenly at your window ready to pick up the prescription. You can certainly jump the queue. You can pick any one RX or multiple RXs in the queue, simply hit F to call up the RX and basically jump the queue and start processing it. Otherwise, all you do is just tell the system, depending on what queue I'm on, just give me work, and it'll start feeding you one prescription after the next. And depending on that queue, you can then start addressing those prescriptions. So in this case, I'm just going to go click the Get Work button on here, and it brings up that prescription that I scanned in earlier, that new RX, allowing me to complete any data entry information if I want to. And this brings me up to my main filling screen at this point. Now, across the top here, I've got a summary of the patient, the drug, the doctor. Down here, again, the allergies and conditions for that patient, SIG coding and route information, the quantities, the dispense quantity, day supply, the number of repeats, for example. On the lower corner, we've got the third-party plans that are going to be part of this prescription. Now, that grabs that from the patient record and presents it in the same order that those plans are recorded on the patient file. But down at the RX level, I can even drop the third-party plans off or rearrange them if I need to, and it'll remember that for subsequent refills. And then over here, I've got sort of a message board area. Any messages, sort of like we use the traffic lights of red, yellow, or green, as to statuses that you need to be aware of as you're filling this particular prescription. Over on the right hand of the screen, and this appears on all of our screens, I have what's called a ribbon bar. And these buttons on here change based on the context of the screen that you're currently on, so that it's always showing you the most commonly used functions. So those people that like to use the mouse can actually use and just click on the buttons, whereas other people that may like to use the keyboard can access a lot of these functions through the menu bar at the very top of the screen. Now, in this case, I've got all the information up on my fill screen. If I want to make an adjustment or I want to dig down into the details of either the patient, the drug, or the doctor, again, I can use the same function keys to be able to gain access to them, make any changes, and then bring them back up onto the fill screen without actually getting out of the prescription itself. Once everything's entered, I'm simply going to hit the F12 fill RX. F12 on Kroll, that's the main go button, essentially. Now, in this case, what's happened here is it's now moving it along into different queues. So this is actually would have offloaded this prescription into my verified data entry queue. Now, if I didn't have that queue turned on, this would be pushed along the dispensary counter, and this would be showing up in the person beside me in their queue. But because I've turned them all on my window here, my terminal, I'm going to see each one of these items on here. So this is a typical workflow screen right now. In this case, I'm just verifying the data entry that was done earlier. And at the bottom of all of my workflow screens, I've got these 4 buttons. The cancel the RX gets out of here, and abort just gets it out of the queue completely. The trouble button allows me to essentially park this prescription. I might see a problem on it that I want to address, but I don't want to tie up the other prescriptions behind it in the queue. So I can actually park this by using the trouble and set a time as to when I want this to reappear in my queue. And if I don't address it by then, it will then actually show up as an alert back on my main screen that something is now due. The reject button allows me, if I've identified a problem in the state that I'm currently in, I can actually reject this and send this back to an earlier step in the workflow. And I can add a note in there as to why I'm rejecting it and sending it back to an earlier step in the workflow queues. And then, of course, the approve button. Everything's good. I'm just going to go hit the enter key of this or click on the approve button, and that will move this along to the next step in the workflow. So in this case now, the adjudication is taking place, and I'm just simulating the typical response back on my screen here. And the next step now is actually going to be checking the patient's profile for any potential drug interactions. And again, all this can be configured as to where in the process this takes place. Just like my regular workflow screen on my drug interaction screen here, I can also reject this or send it to trouble if I want to. In this case, I'm just going to hit the proceed button. Depending on which province that you're in, the system is always looking for professional service opportunities. So it takes a look at the rules of the province. In the case of a medication assessment, it's checking to see how many prescriptions the patient's got on their file, what type of medical conditions that they may have, when did they last have a medication assessment done. And based on that, the system's saying, hey, I think this patient is now possibly eligible for an assessment. Now, in this case, the patient's not in front of me. I can add this to a separate queue so I can deal with all my med reviews at a later time. My labels, in this case, is printing out. Of course, I'm just showing you on my screen here right now. I'm showing you a laser label set, but Kroll certainly supports thermal labels as well. So you can either have laser sheet or individual thermal labels, depending on what you're even using today. Now, basically, my labels is finished off. I have my labels ready. I can start doing the packaging. And if I didn't have all my queues turned on, I'd be going back to the next RX. Now, in the meantime, this is going to show up on the person who's designated got the current package RX queue enabled, in which case right now it's me, as I have all those queues turned on. So at this point, I'm going to go grab the bottle off the shelf, and I'm going to have typically a barcode reader at this point. I'm just going to scan the UPC number off of that bottle, and it will basically confirm that I've got the UPC match, and it has, in this case, in a quantity of 30. I may not be packaging the entire amount right now. I might owe some. And I can also type in an expiry date and a lot number. And again, this is configurable. We can set that up to be completely optional. We can force it for an entire schedule of drugs, or we can even force one or the other on a specific drug if we want to, where you have to enter that before you can proceed further. Now, in this case, everything matched. The UPC was correct. I've packaged the entire amount, so I get the nice big green bar across the screen there. If I had grabbed the right product, but in the wrong pack size based on the person doing the data entry, I'll get a big yellow message across there to warn me I do have the right product. I've got the wrong pack size. I can either go back to the shelf and grab the right pack size or change the data entry to reflect the real pack size I'm going to be using, and that way my inventory for the specific pack I'm using stays accurate. If I'd actually grabbed the entire wrong product and scanned that UPC, there'd be a big red bar across here, and it would require me to actually go and find the right product before it let me proceed. And again, this would now get offloaded to the next station, in this case, the Verify RX packaging. So if you employ, for example, a technician, this allows the tech now to actually double-check the packaging that's actually being performed. Now, again, these are all configurable. Earlier, I just simply had to just hit the Approve button, but I've decided on my packaging step, I'm actually going to force the user to check off the individual steps of the patient, the drug, the doctor, including the actual SIG coding information and quantity on here. And until they check all those off, I can't actually access the Approve button. Now, this is configurable. I can disable this. I can actually turn this from a 5 to a 7-point check. But in this case, I'll just leave it sort of middle of the road with the 5 points. I'll actually check all of these boxes. And once I've checked them all, the Approve button appears. So I can click on Approve and push this over to the next queue. Now, in this case, again, this comes up with the pharmacist, sort of the clinical verification step. So on this particular step, I've actually got everything laid out, because this might be the very first time that a pharmacist is actually seeing this prescription. So like the fill screen, I've got a summary of the patient, the drug, the doctor, the basic quantity information. I've got any interaction messages that came up during the process of the prescription and any regular messages on the prescription itself. And I've got a patient profile shown at the bottom of the screen. So I've got everything available for the pharmacist to see at once to verify that it's clinically appropriate. Now, there are these tabs across the top here. I want to highlight one of the tabs on here, and specifically I want to show you the workflow tab, because this is where this is all wrapping together. This prescription isn't quite completed yet. It's about 2/3 of the way through all the steps, but this is showing you each step that it's actually gone through. More importantly, it's showing you when that step was completed and exactly who completed that step. Now, this information stays with the life of the prescription. So if at any time there ever is a problem that needs to be addressed, or we need to go back and check for auditing purposes, I can bring up this prescription and all the various workflow steps are shown, and I can see exactly who touched it, when they touched it, any comments that were left at the time, and so on. So all of that's available to me, not just now during the workflow step, but at the entire life of the prescriptions in my system. I'm just going to hit the approve button, and that prescription is now finished, and I'm back at my main start screen. Now, typically, at this point, that refill would have also come up for me to process as well. But again, I'm just trying to speed up the process here for the time that allowed. What I want to show you now is the pickup step. So I've processed the entire prescription. It's gone right through to the pharmacist verification, and we've now dropped it in one of our drawers, waiting for the patient to come in for pickup. So under my screen, I've got down here my 2 prescriptions, assuming I'd filled the second one as well. They're in the drawer now. They've been sitting there for 1 to 7 days. This gives me a quick little look at just exactly what is sitting in my drawer. So anything that's showing up under the 28+ days, I might want to actually go through and start reconciling and potentially calling patients up. And we've got a great feature to be able to do that on here. But otherwise, I'm just going to show you and walk you through the basic pickup feature. So I'm now sitting over at my pickup window, and the patient presents themselves. So I'm going to select the patient name, again, part of the last, the first name. In this case, it only shows me matching patients that have something waiting to be picked up. So I'm going to select my patient. And here are my prescriptions now that are currently waiting for that patient. I've only done 2 prescriptions, so they're both showing here. But any prescriptions, no matter what step they are in the workflow process, will show on this screen, and it'll also indicate what step in workflow it's sitting at. So instead of just grabbing the 2 out of the drawer, there might have been a third one that's got held up in processing somewhere, and it would show me on this screen, and it would tell me what step that prescription's actually at, so that I can run down to, for example, the packaging window and find where that prescription's sitting and why it might be hung up there. So there's my 2 prescriptions, and right now I've got them by default both checked. It's telling me that of those 2, the total patient co-payment will be close to $9.5. I can check that with the patient, make certain that they have enough cash. That's a very large number. I can uncheck 1 or more of the prescriptions. So I only need, if I want to, I only need to pick up some of this work order, and I can leave the balance in there for picking up at a later time. But in this case, I'm going to confirm I'm going to pick up the 2 items. Now, in this case, the system's asking me, well, who's the actual person or agent at the counter picking up the items? It does default to the patient themselves, but it may not be the patient actually doing the pickup. So at this point, while I can select the patient, I can also select other. And when I select other, I can either select a patient, another patient that's already in my database, or I can either just simply type in the name of that person who's here doing the pickup. As a bonus, what I can do, if I have a 2D barcode reader, I can actually scan the back of any government-issued ID that has a 2D barcode on the back of it, and it will automatically drop the information into the screen. So back of a driver's license or a healthcare card that's got that 2D barcoding will actually just put all that information and drop it right into this screen. On top of that, there'll be an indicator that I actually got this by scanning some ID rather than just typing it in. So I know later I actually had a piece of identification that I scanned the information right off of. In this case, I'm going to hit confirm. It shows me the last step of all the prescriptions. I'll do one final confirmation, and it goes back to my pickup window so I can dismiss that person that's doing the pickup and now work with the next one. Now, that pickup is also recorded with the prescription. So maybe John himself shows up 20 minutes later to do a pickup, and you can't find his prescriptions. Well, you go to his profile and you bring up either one of those prescriptions and then take a look to where the workflow information is. We'll actually show you that his wife's Mary came in, and we'll show you the timestamp that she was here to actually do the pickup. So there's another advantage of using both the workflow in conjunction with the pickup area as well. Now, I said, as promised at the very beginning, I don't want you coming away from this thinking that it's going to take you 20 minutes just to fill a basic prescription on Kroll, because that's not the case. I wanted to show you all the neat features that you could employ in your pharmacy, but I also want to show you that you can actually narrow this down. As I sort of had an earlier screenshot, I'm going to go from all of these different queues to just basically no workflow at all. I've just basically got a drop-off queue or showing me that something's in progress at the time. So I'm going to walk through and fill that very same new prescription again that I did earlier, but with no workflow enabled whatsoever. So I'm just going to hit F12 to fill a new RX. I said that was the main button on Kroll. It comes up with a blank prescription fill screen. I'm going to type in part of the patient name, part of the drug or the DID, a bit of the doctor name or license or phone number, the quantity, day supply, authorized amount, and then hit the enter key to start looking everything up. So it'll bring up the first matching patient based on what I actually typed in, so I can verify I've got the right patient. I can make changes if I need to. I can pull that patient forward, and now it's finding me the closest matching drug card that based on the information I typed in. And again, now I'm over to my doctor card, and I'll bring that up onto my fill screen. So that's that fill screen again that we saw earlier. I've got all of the information pulled in. I can quickly branch back to the patient, the drug, or the doctor. I can make any other changes. Once I'm happy with everything on there, I'll simply hit that F12 to fill the RX. There's my adjudication results screen. There's my interaction checking screen. There's that review for any professional opportunities I may have. There's my labels that would be printing out. And I can go back to essentially a blank fill screen. I retain the patient and the doctor on the assumption you may have another new RX, so you can just simply type in the new drug for the same patient and doctor and continue on. Otherwise, if that's the only RX you've got, you can just hit the Alt-X key and you're back to the main start screen. And that's it. That's a simple fill and bill system. So I've gone from two extremes here, showing you where all of the different workflow queues are enabled, and you can walk and monitor that prescription through all of the different steps. I can have a drop-off window and record the information at drop-off time. I can have a pickup window, or I can just have a basic fill and bill system or anything in between. Now, of course, if you have only a no workflow system like this, you lose the advantages of all that auditing. I really don't know who did the packaging or the verification. I only know who actually filled the RX at that point. I don't know whether it ever did get picked up or by whom as well. Now, typically, when we're going to be going into a new location, we have you fill out a long form just showing us how your pharmacy is laid out. And the idea is we can go through some of the details of workflow, and we do try to configure the workflow, if you're interested, that fits into the workflow you're already doing today in your pharmacy. We don't want to fit your work into what the computer is going to let you do. You tell us what you do, and we configure our system to do that. You don't need to have all the workflow implemented there. Maybe you just saw what you just saw right now. You like the packaging step. So we'll just set a packaging step. Or maybe you like the packaging and the pharmacist verification step. So we'll just build two queues in for you. And even then, you don't have to use drop-off or pickup, but you can if you want to. So all of that is configurable. And then within each of those steps, I had noted that so too are how much you need to check off before it allow you to open up the approve button and move on to the next step. Now, there is a whole bunch more, and I don't want to not say something about these as I've moved. I've touched on some of these, and I want to make certain that you are aware. At the very beginning, I noted to scan in my prescription image for workflow purposes, of course, I need a document scanner. If I'm going to be using that, I typically can have one right at my drop-off window. So right at the intake, I can scan that prescription in immediately and allow that digital image to actually go through all the different workflow steps. Conversely, I can just throw a document scanner at the end of the process. I can actually work off the original prescription, make my notes on it, sign my original prescription like I normally do. But in the process, it can actually attach a 2D barcode sticker to that prescription. So at the end of the day, I can actually feed all those prescriptions back into my scanner in bulk, and it'll read the 2D barcode and automatically reconcile that prescription image with the electronic prescription and attach it to it. Document scanners are also handy in the fact that any of the reports that we print out that typically may get faxed back into us, we print a 2D barcode on the bottom corner of those reports so that as you're processing them, our system will read that 2D barcode and know exactly what type of a report is coming back. For example, if it was a refill authorization request to the physician, we can automatically present the results of that up on your screen with that document attached. And they can work through the prescriptions we know that were on that report to whether or not the doctor either okayed or refused them. And then that actual document gets attached to the prescription as the new order. I did certainly talk about barcode readers. They go from a simple linear barcode reader, as I noted that I can use to scan a UPC code. I can also print linear barcodes on your vial labels as an example. So if a patient wants a refill at your counter and they present with your label, you can actually just scan the barcode on the label and it will automatically start the refill process for you. But then you can also get these 2D barcode scanners as well. I noted where I was typing in or allowing entry for an expiry date or a lot number. Well, some of the new products actually have the expiry date and lot number embedded on a 2D barcode right on the product itself. So not only are you scanning the UPC code, you can actually scan the expiry and lot number right off of that 2D barcode. And as I said later, too, I can actually read the back of any government-issued ID that has a 2D barcode on it, and I can use that for either my patient pickup, or I can even use that to create a patient directly from just scanning the back of one of those cards. So there's two types of barcode readers. There's just a basic one that only can do the linear ones, and then there's the more fancier one that can actually read the 2D barcodes as well. Now, while I did show a doctor signature way back at the beginning, we can also employ signature capture pads in the workflow processing. So, for example, when I'm doing that pharmacist clinical verification step at the very end, and I'm checking the different steps on the process, when I hit the OK button, I can enable or require the user to have to actually sign on a signature pad. So a screen will pop up where they'll then take the wand and actually sign on the electronic pad, and that signature will be stored with that particular workflow step and, again, stays with the life of the prescription. You can take that a little bit further, though. You can turn that pad around or get another pad and actually expose it to the patient. So any professional service where a patient signature is required, I can do electronically and have the patient sign. At my pickup window, I can force the patient to either sign for every prescription or, for example, just for a certain schedule like narcotics. So again, I can use those signature capture pads for both internal processes, and I can also expose to the patient itself. Inbound, outbound faxing, at the very beginning, I sort of showed you a little tile on the main screen. Well, this is an optional feature in Kroll. This is the one optional feature I've been talking about tonight, where you can actually do away with your fax machine, build it right into the Kroll application. Any report that you today typically have to print out, walk over to the fax machine, scan it in, type in the fax number, and send, you no longer have that step at all. Right from within the Kroll system, instead of hitting the print button, you can hit the fax button. and it will automatically just drop that into a queue. In the case of a prescription authorization request, we've already got the doctor fax numbers on file. There's no more rekeying or anything. It just goes out to the cloud and gets sent out to that location. And then for inbound documents, no longer, again, do you have this big pile coming in a fax machine. It goes right onto your main start screen with that tile indicating to you you've now got an inbound document of some type. And that way you can go onto that screen, and one of the advantages there, especially for faxes, is if you've got junk fax, all you need to do is hit the delete button and it's gone. You didn't waste any paper or toner or any time in grabbing that information off the fax machine. It's right available to you on your main screen. And obviously, if it's an incoming prescription, as I said, you can immediately pick on that one and start using it to process a new prescription. And I also, again, did touch on it earlier, is we do have an appointment calendar available in our system as well. You can configure, if you want, to have just a single calendar for everything, or you can configure to have every user have their own personal calendar, or you can configure a different calendar, for example, for each professional service that you're going to be offering as well. So this is all up to you as to how you can actually configure and take advantage of the appointment calendar. Now, I really have just scratched the surface of the system, and as I say, I don't believe I've done it really enough justice. This is just to show those of you who have really not seen the Kroll system at all, just to sort of get the juices flowing, to allow you to ask some questions about it. I could go on for another 3 hours and showing you all the wonderful features and really sell it to you, but they wouldn't let me. They told me I had to be done in 45 minutes. I do want to touch real quickly on conversion. Kroll has done a lot of conversions over the years, and before TELUS came along, our conversions, despite that, was still very good. We probably converted easily 80% of the information across. Now that TELUS has acquired Kroll, we can now actually talk and work with the developers on the other systems to get that extra 20% that we didn't have. So our conversions now are really clean, but you can help us make them even cleaner. When you do sign up for Kroll, we'll send you out an information sheet that's going to ask you a lot of questions about your current system. Some of the important things on there, for example, are what kind of labels do you use? Is it laser? Is it thermal? We'll probably ask for a label sample. We don't want to assume that our label stock that we use is the same size of label stock that you use. If you have any custom pre-printed reports that we've got to fill in the blanks, we need to see samples of those. We may already be able to fill in those reports, but if we don't, we may have a close equivalent that you might want to consider using, and failing that, we may have to do some custom programming for you to get that to work properly for you. Also, while we are converting the data over, some of the stuff that can't be otherwise picked up might be some areas that you are using the system for somewhere it's not necessarily intended. For example, you might have an asterisk at the front of a doctor name. That might mean something to you, like no phone refills, for example. If you have anything like that, let us know, because we may have a better spot to put that in, or we may leave it there, but we may be able to turn on or trigger another function based on whatever that means. So if you've got any little notes like that or any tweaks that you're using with your current system, bring that to our attention during that survey so that we can maybe consider that as part of the conversion so we can capture that properly for you on the Kroll system. And really, that's basically everything I wanted to talk about. Now, as I said earlier, as we've been going along here, we've had a Q&A session going in the background. Scott, who I've not allowed him to talk except for the very beginning of the whole presentation. Scott, do you have any other questions that you've queued up, or any questions at all that you would maybe like to share with the entire group while we're waiting for the ones to come in on the phone?
I actually have a question that came in on the chat that may be of interest to everybody. And Russell, maybe you can help me out with this one too, is do Kroll users have to use the transaction number-based system, or can they continue to use the legacy RX number-based system?
Oh, I can certainly help that one, Scott. Basically, the way the Kroll system works is it actually has a software option to decide what number you actually want to use on your label set. Now, technically, the Kroll is using a transaction-based system behind the scenes, but it also has the original prescription number recorded with each one as well. So, for example, we certainly, as typical default, have narcotics always printing the current number. So if you're doing a part fill, it's actually always going to print the current transaction number. It looks just like the same length as a regular prescription number, but for non-narcotics, it's really configurable, your choice. Do you want to always show the original prescription number on every single refill, or do you want to print a unique prescription number assigned to every particular number? And just to be clear, our prescription number and transaction number are really one and the same. It's not two different ranges or anything, but it just comes down to your choice on whether how you want to represent, again, the non-narcotic and the refills as to which of the two numbers you want to appear. Scott, anything else that came in?
No, Russell. None more.
Okay. Well, everybody, like I said at the very beginning, I mean, once again, I thank you for participating. I feel I have just scratched the surface on the Kroll system. I could talk for certainly the rest of the evening about all the features and all the neat bells and whistles. I know with what I've shown you today, with maybe the workflow aside, your system can fill prescriptions just like our system can fill prescriptions. I haven't been able to sort of highlight the additional features or anything else that it does, but this was really just to get you that initial feeling, that initial sight of what Kroll does do, what it can do for you, and hopefully again we'll get some talk. If you've got some questions there, again, please forward any additional questions to us. And I appreciate, again, everybody joining in for this evening. So thank you very much.